How does FOTO, how is it of value to me? It's extremely important. I use this data to manage my patients. In fact, I won't even discuss patient care unless somebody, another therapist comes in and asks me, what do you think I should do about this patient? I say, I want to see the FOTO data. I want to see what you've collected. And the skill is not just getting the patient on FOTO for your intake, but learning how to use that data during real-time clinical practice and use it as an external or a benchmark to decide how efficient or effective you are in managing that patient's care. I think there's two real reasons why I think I'm really interested in collecting outcomes. And one is kind of like a financial incentive. I think the market is going to change. And it's up to us to educate the payers on why this data is important to justify or quantify our reimbursement. The other big issue, and I think this ties in well with the APTA's 2020 vision, and that is to become competent rehab professionals. Well, the only way you're going to do that is, you got to know your physical therapy stuff, you got to know diagnosis, you got to know to classify patients, but you have to demonstrate leadership. Clinicians have to demonstrate leadership by collecting data during routine clinical practice, and they need to show outcomes. And using that FOTO tool, especially since it's risk adjusted, it's very important to not just take data that's raw data. You need to have it risk adjusted so you can get a meaningful interpretation of what you're doing. And you can start on your feet looking at the efficiency and effectiveness of your treatment strategies. And if you collect this data on a regular basis, and I do that all the time. If I have an acute patient, third visit, I'm doing a survey. If it's a chronic geriatric patient, maybe I wait 10 days. But I use this data to think on my feet. It helps me to manage, plan for discharge, as well as alter my treatment strategies. And I always like those terms, efficiency and effectiveness. If you cannot be effective, you should learn that so you can be efficient. But the ultimate goal is to be effective, improve the patient's quality of life and their function, and do it efficiently.